A blessed day, everyone. I'm Laurelyn, and in relation to our subject, which is the theoretical framework in nursing practice, I'll be discussing the role of knowledge development in the evolution of the discipline of nursing, nursing science, and advanced nursing practice. So, the following topics will be covered, such as the introduction, evidence based and practice based evidence, nursing informatics, model and theory development in informatics and evidence based practice, and nursing practice research and theory. Before we identify the relationships between knowledge, theory, research, and practice, we should start off with the definition of the basics on knowledge, which is being developed by science, and it is often summarized or synthesized into a theory. Theories, on the other hand, guide both research and practice. Theories that are useful in nursing practice describe phenomena, explain how things work, predict results, or prescribe interventions or therapies. Theory can be used as a framework for nursing practice by way of the theory of a phenomenon, which is illustrated below. In this schematic figure of theory, antecedent conditions lead to mediating events that then affect good or poor nursing. So this is really helpful when routine approaches are only partially effective or when challenges to usual practice arise. They say that the lack of needed theory does not excuse us from the obligation to develop the knowledge that will lead us to those theories. So we must still have to consider not only theory but also the broader context of knowledge development to nursing practice. So we nurses must demonstrate that we can provide safe, quality care that is cost effective by providing evidence of effectiveness that requires interactions among fields of evidence based practice research, practice based evidence research, improvement of science, team science, and theory development. Next is evidence based practice and practice based evidence. So, what is evidence based practice? So, according to Sackett, Rosenberg, Gray, Haynes, and Richardson in 1996, it can be defined as a consensus, explicit, and judicious use of current best evidence about the care of individual patients, integrating individual clinical expertise with the best available external clinical evidence from systematic research. For French, in 2002, evidence-based practice is the systematic interconnecting of scientifically generated evidence with the tacit knowledge of the expert practitioner to achieve a change in a particular practice for the benefit of a well-defined client or patient group. Roberts in 1998, on the other hand, states that evidence-based practice uses evidence gleaned from research to establish sound clinical practice. Eisenberg, however, in 1998 contends that evidence-based clinical practice draws on the findings of research to provide information to improve patient care for each individual, while at the same time challenging researchers to address the questions for which clinicians and patients most urgently need information. Duan and Varco in 2008 postulate that the interconnections between theory, evidence and practice may be lost in translation as nurses try to live, translate, and act knowledge in complex arenas of practice. Decisions that are evidence-based are often hampered because many interventions have limited formal research evidence to support them, or there are serious barriers to the implementation of the practices. So, how practice based evidence differs from evidence based practice? So, according to the theories of Horn and Gasaway in 2007, they have suggested a means to overcome the problem of using only RCTs as the basis for evidence based practice, mining large databases to gather the data needed to demonstrate quality and effectiveness. Practice-based evidence attempts to capture in-depth, comprehensive information about patient characteristics, processes of care, and outcomes while controlling for patient differences. This figure shows how evidence-based practice and practice-based evidence relate to practice, research, and theory. So practice is the central and core phenomenon and the basis for our existence and focus of our work. So all other aspects of knowledge development are framed around it and interact with it. In this illustration, theory not only guides practice but also generates models for testing in research through practice-based evidence or evidence-based practice. So research and clinical data provide evidence for evidence-based practice or practice-based evidence that can subsequently generate practice guidelines and or theory. So the process is interactive and iterative. According to Sampsell in 2007, research requires a two-way transfer of knowledge between the scientists and the communities they serve. This is particularly true for nursing research and theory. Next is nursing informatics. So, nursing informatics is a combination of computer science, information science, and nursing science, designed to assist in the management and processing of nursing data, information, and knowledge to support the practice of nursing and the delivery of nursing care. There are three main trends relating to nursing informatics. Firstly, the technological explosion, which enumerated the dramatic changes in computers, information systems, and telecommunications, technological changes in patient care and diagnostics, and improvements in accessibility of clinical data. Secondly, it's related to the cost of healthcare, the changes in healthcare systems, and the lack of insurance coverage by huge numbers of persons. And the third trend is the significant advance in nursing science and research highlighted the increasing numbers of studies that provided a scientific basis for nursing care to improve patient outcomes. Next topic is on the model and theory development in informatics and evidence-based practice. So there are three groups of authors actually proposed models of theories related to evidence-based practice or informatics. According to Kolkabe in 2001, who presented a fascinating discussion of the development of the middle range theory of comfort and its eventual use for outcomes research. She carefully detailed the steps taken to build and refine the theory and demonstrated how using the theory in outcomes research benefited not only the patients but also some institutional outcomes related to nurses' productivity. According to Smith et al. In 2002, they used the caregiving effectiveness model to predict the outcomes of family members' caregiving on technology-dependent elders in the home. So the authors found that nurses were very willing to use the verified relational statements in the model to generate nursing interventions. For Mitchell, Ferkertich, and Jennings in 1998, along with the American Academy of Nursing expert panel on quality healthcare that proposed a dynamic model for quality health outcomes. So they suggested that the model is broad enough to allow for research and system level interventions and outcomes at both individual and systems levels to guide information of relevant clinical databases and to help researchers identify key variables for study. The last topic is on the nursing practice research and theory development. So according to Blegen and Trip Raymer in 1997, who suggested that established taxonomies of nursing languages might constitute the basis for middle-range theory development for nursing practice. So they contended that linking nursing diagnosis concepts with interventions to predict expected outcomes is a reasonable way to construct theory that is relevant to and supports evidence-based practice. So the very core of practice-based evidence research methods depends on the accessibility of large sets of data, including nursing data, in order to conduct the studies. Also, having standardized nursing concepts in these data sets allows for an amazing variety of studies to be conducted relating to many aspects of patient care, nursing management, and cost-effectiveness evaluation. This figure illustrates the theory of impaired home maintenance. So this is the final theoretical model. So though this model is used primarily for illustrative purposes, it demonstrates how using a standardized language facilitates theory development. So basing from the illustration earlier, the antecedent conditions are the following: impaired mental or physical functioning, inadequate support systems, insufficient family organization, and inadequate or insufficient equipment. On the other hand, the intermediate conditions are the overtaxed family members and unhygienic environment that led to the impaired home maintenance. Learning from this section, we believe that using standardized languages is an efficient means to clearly link the elements of practice, research, evidence, and theory into a meaningful program for knowledge development in practice. However, there are other models that are equally efficient for generating theory for practice. In summary, nurses use theories on a daily basis and certainly relevant to practice. So we must explain our thinking and to predict the outcomes of our nursing care. So the main focus is on the quality and safety in patient care to demonstrate the effectiveness and efficiency of their care. So theories and research that develops and tests can help in this endeavor. So we still have to explore the interactions between theory, research, and practice and how they form a matrix to improve patient care. Well, that's the end of my report. Hopefully, you've learned something from my output. And thank you so much. God bless us all.